Good morning. The Select Committee on Veterans Housing will come to order. I'm Chair Jerry Newton. This morning, we're going to be addressing the issue of veterans homelessness, but before we get into that, I would like to give you a little background on this committee and why it was formed. First of all, we have 5 veterans homes in Minnesota, accommodating roughly 950 veterans. We also have about 1,000 veterans on the waiting list, active waiting list to get into veterans homes. Secondly, the speaker has asked me to try to find out how we can work with federal rules and restrictions which reduces the state's flexibility when it comes to not only veterans homes but homelessness, dealing with the issue of homelessness. Last session, as you may know, there was a bonding bill that passed for $18 million to finish Phase 2 and start Phase 3 of the Minneapolis Veterans Home. That bill is to be matched by $36 million from the federal government for a total of $554 million for 100 beds, which comes to a total of $540,000 per bed. This raised concern among legislators and on the part of the speaker that he thought it was extremely costly, and he asked that we form this committee to look at all issues that pertain to veterans, whether it's homelessness, veterans housing, how we can do things better at less cost and provide for more veterans. So he specifically charged the committee with these issues. He wants to know how many veterans in Minnesota lack high-quality, safe housing and why. What current options exist for veterans housing, including an assessment of geographic access and cost. Where do Minnesota veterans live, and how can we assure they can receive long-term care in or close to where they live, including the potential use of private nursing home beds that is cost-effective for Minnesota. What federal restrictions exist on the options available to Minnesota, and are there ways to work with the federal partners to provide more flexibility? As you may know, there's a cap on the number of beds that the Veterans Administration permits the state of Minnesota. That's 1,058 beds. We had 4 active applications for housing outstate in Montevideo, Brainerd, Bemidji, and no, not Fergus Falls. It was Wilmer. When the application went in for Phase 3, this last time with the bonding, the Veterans Administration previously had informed the state that we would exceed that limit of 1,058 beds. And so the applications for those outstate homes were all pulled. They were pulled, and it caused some consternation because legislators and communities weren't informed that those homes were no longer being actively considered. Since the end of the session now, staff has been gathering information from local MDVA, from the VA, from housing sources, and most of what you have, most of the essential information is in the packets that that we have here on the committee and that are available on the table over there. There's been a lot of misinformation about the intent of this committee, where we're going. We have no sort of pre-convictions of what we're going to do. We want to hear testimony. We want to examine everything that we can, and we'll come up with recommendations, give those recommendations to the speaker prior to the 1st of February deadline. This morning now, we are going to hear testimony focusing on veterans homelessness. And the first testifier will be Katie Topinka, who's Legislative Affairs Director for MHFA. And Tanya Moore, I believe, is coming with her. Good morning.
Good morning. Mr. Chair, I'm Tanya Orr. I'm an Assistant Commissioner with the Housing Finance Agency.
And I'm Katie Topinka with the Housing Finance Agency.
And we're going to take turns providing you with some information.
Thank you.
Mr. Chair, we thought we would start with just a brief overview of the agency and our mission for those who aren't familiar with us. Minnesota Housing is a state agency whose mission is to finance affordable housing for low and moderate income households while fostering strong communities. The agency is somewhat unique. We're governed by a board of directors who are appointed by the governor. And we also are, the agency is run by a commissioner who's appointed by the governor. And our operating costs are not funded through state appropriations. Only about 9% of our agency budget comes from state appropriations. Our operating costs come from the spread on tax-exempt bonds that we issue to fund our first-time homebuyer loan program. We are the second largest issuer of tax-exempt bonds in the state. So because our operating costs are not paid for with state appropriations, 100% of the appropriations that we receive go to programs. We have a single-family and a multifamily division. Our single-family programs include a first-time homebuyer loan program, a refinance program, home improvement loan program, and a rehabilitation loan program that is funded by state appropriations and serves very low-income homeowners. Through our multifamily programs, we provide capital for new construction or preservation of affordable rental housing. And most of our multifamily development funds are distributed through an annual request for proposal process that is a competitive process. And the multifamily rental developments serve low and moderate income households. So at that, I'm going to turn it over to Ms. Orr to talk about the business plan on homelessness and some of our current work on homelessness issues.
Just to give you a few facts to set the stage, every year the Federal Housing and Urban Development Department requires entities throughout each state to count the number of persons who are homeless on a given date. It's in January, which is not the best time to be counting people who live outdoors in Minnesota. But we have a number of years of these point-in-time counts. Last year, there were about 8,200 people who were counted as being homeless, and that was a slight increase over 2012. Of those 8,200, 350 were identified as veterans. This was also a slight increase over 2012, but between 2011 and 2012, we saw a 31% decline in the number of veterans who were counted as homeless. Now, it's difficult to count people who are homeless, and particularly in January. So we know that this is most likely an undercount of the number of people, but it does give you at least some sense. We have another reference point, which is the Wilder Research Center's survey of homelessness in Minnesota. They have been conducting this survey every 3 years for a number of years now. The last survey was conducted in 2012 in the fall. And they reported that there were, they counted about 580 people who were homeless and report that they served in the U.S. military. This is out of a total of about 10,000 people who were counted as homeless in the fall of 2012. We do know that we have seen a significant decrease in the number of people who are chronically homeless, meaning in Minnesota we define that as homeless for more than a year or multiple times in the last 3 years. So we have noticed a considerable decline in the number of chronic homeless. And as I said, the number of homeless vets has declined, except for this last year. We saw a slight increase. To give you another sort of context setting, there are 600,000 households in Minnesota who are housing cost burdened, meaning they pay more than 30% of their income for their housing costs. So depending upon how burdened they are, a lot of those households are at risk of being homeless because they can't afford their housing. 30% of your income for housing is the standard that's used at the federal level, and we use it at the state to determine whether or not you have affordable housing. So 600,000 households in Minnesota are housing cost burdened. The state has made a number of efforts to address homelessness in general. We have had programs that Ms. Finkel will talk about to prevent homelessness. But in 2004, we started an effort to end long-term homelessness. We asked the legislature to direct that we set up a task force to develop a business plan to end long-term homelessness. The reason that we were focused on long-term homelessness, there were a couple of reasons. One is that we knew that people who experienced long-term or chronic homelessness were some of the most expensive users of services, both shelters and supportive services, and things like emergency rooms, detox, those sorts of very expensive care. So we recognized that we could spend the same sort of money and provide a much better quality of life for people who had been on the streets for a long time. We developed a business plan. Based on the Wilder survey, we determined that we needed to create 4,000 housing opportunities. And we use the word opportunities because it's not just about the capital costs, but we can also provide housing opportunities by providing a rental assistance or housing assistance voucher for people to use in existing housing. We developed a plan for how to finance this, and our goal was the 4,000 housing opportunities, which would be permanent supportive housing. So we were making a decided change between managing the problem of homelessness to solving it. So it wasn't about a temporary shelter, but it was a permanent place for people to live. We have now financed those 4,000 housing opportunities. Not all of them are occupied yet, because some of them are still under construction, but over 3,000 are occupied. Our experience to date is that over 85% of the people who live in this permanent supportive housing remain in the housing for at least a year, which, when you think about somebody who's been on the streets for a year or more, and then they come into permanent housing and they're able to stay. This is housing that's affordable to people with whatever income they have. They have to make a contribution to their rent. We are very careful to make sure that if we fund the capital costs of the permanent supportive housing, that the supportive services are in place. Because we recognize that it's not, for people who are long-term homeless, it's not just about the shelter, but it's also about having the supportive services they need to be successful. And our supportive housing providers have done a fantastic job of cobbling together supportive services funding from a variety of sources. So we are about to finish the business plan to end long-term homelessness. And the next step is to develop a new plan to end homelessness in general. The legislature established a number of years ago an interagency council on homelessness that has met on a regular basis to exchange information about programs and policies that affect people who are experiencing homelessness. Last year, or in 2011, with the support of the governor's office, we decided that we wanted to elevate the interagency council to a higher level and to have the commissioners of the state agencies who deal with homelessness be directly involved in the interagency council. Up to that time, it had been a staff level group. So the commissioners it's the commissioners of 11 state agencies. They all either serve people who are homeless, well, all of them serve people who are experiencing homelessness. They may not have direct funding for homeless programs, but they all serve people who are experiencing homelessness. The commissioners have met. They have agreed that they will develop a plan to end homelessness. Part of the high-level plan is that we will finish the job with respect to veterans. So we will, in a relatively short period of time, eliminate the number of homeless vets. And also we will finish the job on ending long-term homelessness or chronic homelessness. And then we have a goal in particular about short-term and long-term ending homelessness among children. We expect a high-level plan to be completed by the end of the year, and more detailed action steps to be done by the middle of the following year. So those are two very high-level efforts that are focused on homelessness. That because we know that a number of people who are homeless are veterans, that these efforts will reach homeless vets as well. Finally, I just wanted to talk briefly about an example at the federal level of interagency or cross-agency collaboration, which is the VASH vouchers. These are rental assistance vouchers, like Section 8 vouchers, that are administered by HUD, but are also, it's a collaboration between HUD and the VA. The VA provides services and case management for people who get these VASH vouchers. It started out as a demonstration program. It is now separately funded by the federal government. And we have in Minnesota over 400 VASH vouchers. These VASH vouchers allow veterans to live in communities of their choosing and to live in privately owned market rate housing. The voucher pays the difference between what they can afford to pay, the 30% of their income, and what the cost of the housing is. They have to be connected to the VA Medical Center for case management and other services. It is a very popular program, and we're very hopeful that we will continue to receive in Minnesota additional vouchers. The Housing Finance Agency does not receive these vouchers directly. They go to public housing authorities throughout the state. And I'm going to turn it over to Katie to talk about specific programs that serve veterans at the agency.
Commissioner, if I just could ask a couple questions. The commissioners who are on the looking at the homelessness, that includes the Department of Veterans Affairs.
It does,
Okay.
Mr. Chair.
Do you have a time frame for ending the homelessness for veterans? Have you set a date on that? And I ask that because I think the federal government had a program where they wanted to end veteran homelessness by 2015.
Mr. Chair, and I believe that that's what the state plan will be, is to try and end it by 2015. We're trying to align with the federal plan to an extent possible, in the hopes that that might also generate some more sources of funding from the federal government. I just want to say something about what we mean by ending homelessness. We recognize that we're not going to do away with shelters. There's always going to be a time when a few people are going to need to go into a shelter. But what we're thinking about in terms of ending homelessness is functionally ending homelessness, so that if you get into a shelter because you lost your job and you couldn't pay your rent, we're going to get you out of the shelter as quickly as possible and into permanent housing. So it's not that shelters will all disappear and we'll never see another homeless person, but we won't have people who are homeless for any length of time is our goal. So we think that we can achieve, because it's a relatively small number of veterans based on the data that we have, we think we can achieve this by 2015.
Good. And then one more question. You say there are 400 VASH vouchers that we're looking for, and veterans would have to be involved with the VA Medical Center. What about the regional areas? Does that mean having them involved with a local clinic if they're in an area outside of the metro area?
Mr. Chair, I know that, for instance, we have VASH vouchers in St. Cloud, but there's a medical center there.
Yes.
And I don't know that any of the vouchers have gone to a PHA that's not in an area that's with a medical center, but I'd have to check to see if that's, whether it's possible to do that as opposed to whether that's actually happened, and I'd be happy to do that.
I appreciate that. Thank you.
All right. Thank you, Mr. Chair. I'm going to continue on and just talk a little bit about some of Minnesota Housing's specific programs, some statistics on the number of veterans we've served, and then a couple of developments that we've funded that are targeted for veterans. So Minnesota Housing, all our programs serve people based on income, and we don't have any programs that are specifically designed for veterans, but we do know that some of our programs do serve veterans pretty extensively. We don't track data on the number of veterans served by all of our programs. We only track that in programs that use the Homeless Management Information System, or HMIS system, which tracks data on homelessness programs. So for us, that includes the Family Homeless Prevention and Assistance Program, and then our long-term homeless funds. So the Family Homeless Prevention and Assistance Program was established by the legislature in the early 90s. It provides funds through counties or nonprofits to individuals and families to prevent homelessness or shorten the length of stay in emergency shelters. It does things like assist in securing transitional or permanent affordable housing. It can provide some short-term rental assistance or emergency mortgage payment, other measures to help families avoid homelessness. So we do know that in our last program year, so state fiscal year 2012, actually, there were 428 veteran households served by the Family Homeless Prevention and Assistance Program, which was about 5.5% of the total households served by that program. And then as far as long-term homeless funds, those are capital costs or rental assistance to provide housing for people who've experienced long-term homelessness. So what Ms. Orr was talking about with our plan to end homelessness, this is a permanent supportive housing for people who've experienced long-term homelessness. And we do know the most recent data available so that was state fiscal year 2012. There were 211 veteran households served by long-term homeless funding, which was 6.33% of the total households served. We, as I mentioned, do have a first-time homebuyer loan program. These are loans that are people go to private lenders to get the loans, but they're financed by Minnesota Housing, and it's for low to moderate income households. We know that 1% of our first-time homebuyer loans are VA insured, meaning that they are veteran households because they are insured by the Federal Veterans Administration. However, we expect that many more of our first-time homebuyers are veteran households. We just don't have the data unless they're specifically VA insured. About half of those loans are insured by the Federal Housing Administration. So in addition to those programs, we have financed a couple of developments that are specifically targeted for veterans. In 2002, we received GO bond proceeds to fund two developments. One is located at the St. Cloud VA Medical Campus and the other at the Minneapolis campus. Both projects are constructed on land owned by the Department of Veterans Affairs, and the developments are owned by the county housing and redevelopment authorities. Both developments serve veterans and single adults who are homeless or in danger of becoming homeless. The St. Cloud development has 60 affordable studio units. The average income of the residents there in 2012 was just under $15,000 per year, so serving very low income residents. The occupancy rate there is 99%, so it's almost fully occupied, and some of that due to turnover. At least 51% of the units must be occupied by vets. At the Minneapolis development, there are 140 units. The average income of residents there in 2012 was just over $17,000 a year. And that's currently at 98% occupancy. And again, there, 51% of the units must be occupied by vets. We know that at that development, typically about 75% of the units are occupied by veterans. Then this past year, as I mentioned, the agency has an annual consolidated request for proposal process for funding both single-family and multifamily developments. The funds available include the agency's amortizing first mortgage product, the state's Economic Development and Housing Challenge Program, which is a state appropriate program, and then last year in 2012 included housing infrastructure bond proceeds, which were authorized by the legislature. And through that process, the Common Bond, which is a nonprofit affordable housing developer, was selected to receive funding to develop 2 new projects that will be targeted for veterans. One is at Fort Snelling, and the other is at the VA campus in St. Cloud. So those projects are not built yet, but they were selected to receive funding last year. And the plans for those at the Fort Snelling project is that there will be 58 affordable units, which will include studios, 1-bedroom, 2-bedroom, and 3-bedroom units, so with the goal of serving some families as well. And the income limits are 30 to 60% of area median income in the metro area. Just to give you a sense of what that is, that's about $17,000 a year for a household of 1 at 30%, and just over $34,000 a year at 60%. For a family of 4, it's just under $25,000 a year at 30%, and just under $50,000 a year at 60%. 7 of the units at that development will be reserved for veterans who experienced long-term homelessness. And then the St. Cloud project will be, I should mention, at the Fort Snelling project, it's on the light rail line, so it will be close, light rail connection to the VA Medical Center. So for those long-term homeless units, will be supportive housing, and the residents there will have easy connections to the VA Medical Center. And similarly, at the St. Cloud development, it will be next to the VA Medical Center. There will be 35 units total there, 33 for single adults and 2 for families with children, and the income limits are the same there, ranging from 30 to 60% of area median income, which in St. Cloud is the same as the metro area. And there, 4 units will be reserved for veterans who have experienced long-term homelessness. So those are just some examples of developments that Minnesota Housing has helped fund that are targeted for veterans. Again, those are permanent supportive housing. So they're independent living, but they're for people who've experienced long-term homelessness, so there's connection to supportive services to help them be successful in remaining in their housing. So with that, I think we are happy to take any additional questions.
Thank you. Representative Detmer.
Thank you, Mr. Chair, and thank you for coming in today. And what procedures do you follow to determine who's a veteran? Do they have to require a DD 214? How do you determine if the person that's getting these benefits are a veteran or not?
Mr. Chair, Representative Detmer, we don't own the housing. We simply finance it, so we leave it up to the developer or owner of the housing to make those determinations.
Okay. And what age groups are we talking about in terms of some of these benefits of the veterans?
I'm sorry, what age group?
What age groups are we talking about?
There isn't a particular age focus. So it has, I think that we have primarily Vietnam vets in the 2 housing projects that are the existing projects, but we don't. It's not targeted to a particular age group, so it's whoever is next on the waiting list.
Okay, Mr. Chair, just follow up. But then, who has oversight as to if these individuals are truly veterans or not? You said the developers.
Yeah.
Mr. Chair, Representative Detmer, the VA is a partner in these because the projects are on VA-owned land, the 2 existing projects. I'm not aware that there's ever been any issue about someone claiming to be a veteran and not being one. But I haven't actually. I will be happy to talk with the owners of the properties and find out what procedures they use to determine whether somebody's a veteran. It's just not something that we've examined.
Mr. Chair, and I think that's important that we make sure that these benefits, these services are actually being, benefiting the veterans that are truly veterans. So I would like to see somehow how this is, what type of oversight we're looking at here.
Good, thank you, Representative Detmer. And I also, in that same vein, wonder about veterans who don't have good papers, who were discharged under conditions other than honorable, whether they're included as a veteran in general, or whether the housing is limited when we count veterans, whether we're counting veterans who were honorably discharged in some manner. Representative Hausman.
To that point, Mr. Chair, I was just going to suggest, I don't know, maybe we are going to have them in, but it looks like Common Bond and Lutheran Social Service are two of the better-known groups that we're talking about here, and they might be good people to bring in to respond to some of this. It looks like Lutheran Social Service has a partnership with Minnesota Department of Veterans Affairs, so they don't operate independently. In your case, though, I think your issue is not so much, yes, you count how many of them are identified as veterans, but your broad-based mission is to deal with all homeless people. And so really, your programs in and of themselves don't subdivide categories of people, I think.
Mr. Chair, that's correct, Representative Hausman. On the two existing projects that are occupied, there is a requirement that 51% of the units be occupied by veterans. That was negotiated with the VA. And it really makes a difference because if the occupancy rate falls below the 51%, then the next person on the waiting list, if they don't happen to be a veteran, will be skipped over till they find a veteran. So I think that, I have some confidence that there is a process in place for determining whether someone is a veteran, because it really makes a difference in terms of who's next on the waiting list in terms of occupancy. Our concern is that the people be of low and moderate income because this is substantially subsidized by the state, and our goal is to provide housing for people who can't afford unsubsidized housing. But we'll be happy to look to get you the documentation and both whether they require an honorable discharge or not. With respect to Common Bond, I would just point out that these properties, while they're financed, they haven't begun construction, so they don't have the experience yet. We hope that they will begin construction in the next year, but they're not ready at this point. So I would say that if you wanted to talk to a provider of independent living housing, permanent supportive housing, it would be Catholic Charities, I believe, is the service provider in St. Cloud, and Matt V is the service provider in, I just wanted to double check, in Minneapolis. And Kathy Vitalis is here to testify, so she might be able to provide you with some additional information. And both of those projects have been in existence for a while, so they have a pretty good wealth of experience.
Okay, good. Are there any other questions? Representative Clark.
Thank you, Mr. Chairman. And I'm sorry I came in a little bit late, so I don't know if you did address this, but so 2015 is kind of the milestone that you're aiming for to end homelessness among veterans in Minnesota. Is that right? Both federal and state efforts?
Mr. Chair, Representative Clark, that's correct.
So, Mr. Chairman, so we're talking about less than 2 years away, and I'm just wondering, in terms of recommendations from the administration to the legislature for additional housing dollars targeted toward veterans, is that in process, or has that already been prepared, or where is that at in order to do that?
Mr. Chair, Representative Clark, We have made a proposal to the administration, to the governor's office for our capital investment request. Those decisions about what will be in the governor's recommendations have not been made, but we have made it those requests were submitted to the legislature around July 1st or July 15th. So we've made a substantial request, but we will not be meeting with the governor's office until November, I believe, about those requests.
So, Mr. Chairman, so you said that information has been forwarded to the legislature?
Mm-hmm.
Could you review for me? I'm sorry, I haven't seen it. Can you review for me what the request is for?
Mr. Chair, Representative Clark, we proposed that this coming year's bonding bill include $100 million of housing infrastructure bonds.
80
in housing infrastructure bonds and $20 million for public housing rehabilitation. The housing infrastructure bonds would be used for supportive housing, for foreclosure remediation, and for preservation of federally assisted housing.
Okay. Thank you. And Chair Hausman is just informing me that we do have that information in the bonding committee. Look, I just haven't seen it, so I'll update myself on that. So thank you for that.
Representative Hausman.
And just to add to that, the encouraging thing about that $80 million is because of the nature of it, we partner with nonprofits that leverages probably at least an equal amount. So I think that was one of the reasons that your department encouraged the state to move in that direction rather than all public housing where we would do it all.
Mr. Chair, Representative Hausman, that's correct. We have been able to couple the housing infrastructure, the appropriation bonds, with a combination of resources that quite frequently the nonprofits who are grantees of this funding do other fundraising to pay for portions of the building. We also have coupled the money with federal housing tax credits, so we've been able to leverage private equity that way. And in the activity of preserving federally assisted housing, we're guaranteeing that federal assistance money will continue to come into the state for a significant period of time.
Thank you. Are there any other questions? Well, thank you. And this, yes.
I'm sorry, I have one more question. So the vouchers that go to our local housing authorities for veterans, those are, there's some oversight by that, I assume, I don't know, is it by your agency or with the VA or?
Mr. Chair, Representative Clark, the VASH vouchers are administered by HUD
Right.
and the public housing authorities, and then they collaborate with the VA.
Okay. Mr. Chairman, I'm just, the reason I'm wondering is I'm aware of some of the veterans in the public housing that I represent, and some of them are doing okay and some of them are having, some difficulties. There's a really creative program that the Minneapolis Housing Authority has done within its jurisdiction now where they are doing assisted living units within their regular public housing. And I'm just wondering, it's just in one place. It's a newly developed project up on the north side of Minneapolis, and I'm just wondering if that's something that we're exploring at all on the state level with others, and how that might impact veterans. Because in some cases, those folks have been members of communities for a long time. Mm-hmm. They've lived in those communities, and so the Public Housing Authority is, helping them stay in their community. I don't know if any of the folks in the Minneapolis situation are veterans that are in that assisted living. But it seems to me, as we look at the whole overall picture of the veterans' homes and trying to deal with that, we might look at that issue of the assisted living opportunity within public housing that can be assisted possibly by some of these vouchers. I don't know. Are you aware of if that's being used at all?
Mr. Chair, Representative Clark, the vouchers are really totally separate from public housing. If someone is a resident of public housing, they don't need a voucher because they're in housing that allows them to only pay 30% of their income for rent. So the vouchers are actually to go out and rent an apartment that's privately owned, that's in the community. So those are two different types of housing subsidies that the federal government provides. So you wouldn't use a VASH voucher in public housing. The Public Housing Authority is the administrator of Section 8 vouchers, and that's why they're the administrator of the VASH vouchers as well.
Good, thank you. Representative Clark, and this afternoon, Mary Mullen will go over some of the initiatives that the federal VA has started with assisted living, adult daycare, foster care for veterans. They have a lot of new programs, and they're looking somewhat at trying to decentralize veterans' homes so that we don't have sort of the institutions that we're looking at, things like group homes and assisted livings, that sort of thing, which is being pushed by the federal VA. And Representative Hausman, we had asked both Lutheran Social Services and Common Bond to come in, but neither one could make it today. So, but we will have that information for you. Good, thank you. Any other questions? Good. If not, this is a good transition. Thank you very much. Good transition for Kathleen Vitalis from MACV. Welcome to the committee, Kathleen.
Thank you. Okay.
Should be good to go.
Oh, there we are. Representative Newton and members, I have been asked to kind of give an overview right now of homelessness. Oh, thank you. And then later this afternoon, during the housing section, I will be talking about MACV housing and what we do, and much of what Minnesota Housing just stated, I can provide real-life examples because I have used the funds that they were describing. But I wasn't going to talk about the housing piece right now. I'm just going to try to set the stage for homelessness from MACV's perspective, and talk about the services that MACV provides, and then this afternoon talk about the housing and how I got into both of those things. So again, a lot of this to some of you is going to be, and I'll go through it quickly. We've been around for 23 years. We're a nonprofit, and we focus on housing, employment, and legal assistance, and the gaps for homeless or in crisis veterans and their families. As a matter of fact, in 1990, MACV started because a World War II Army nurse was sick of there not being housing options for veterans she was seeing at the Minneapolis VA, and through the Veteran Service Orgs, and I won't get into all the details, they had a little home on Front Street that they started to try to tackle veteran homelessness. So from the housing perspective from MACV, and we've grown since then, but basically I now have 3 regional offices in the Twin Cities, in Mankato and Duluth, and we reach out to all 87 counties with our services from those 3 offices. We're, as a nonprofit, audited annually, and of course, I think important, you know, where our certifications come from, the Better Business Bureau and the Minnesota Charities Review Council. As I get into some of this, so that because some of your questions, especially Representative Detmer that just asked, I may just try to address those quickly so we don't forget about those questions this afternoon. And I know one of them, as I put up my housing, where my locations are, HUD-VASH vouchers. And I know that Minnesota Housing is going to get you the definitive on that from the VA, but I can tell you that in general, the majority of the vouchers, of course, went to, you know, Ramsey and Hennepin County, Minneapolis, St. Paul, St. Cloud. Recently, as in the last 18 months, there were a few, and I'm going to tell you what I know, 5 in Duluth, 5 in Mankato. The last round, we had, I believe, 25 in Dakota County. So they are starting to get some of the vouchers rurally. When they do that in Duluth and Mankato, in the rural vouchers, the Minneapolis VA, that's still their catchment area. So they are responsible for case managing those individuals in those vouchers, whether they be in Minneapolis or in Duluth, Dakota County, Mankato, and I'm not certain, Rochester? Yes, and there are a few in Rochester as well. So that is their responsibility to case manage those individuals. it does not come without challenges the further away from their facility that they get. But I wanted to address that there are some rurally now as well.
Ms. Vitalis,
Yes.
if I could interject.
Yes.
We, in the packet here, we have the distribution of the HUD-VASH vouchers, so you can see where they're going.
Okay. And what I provided to him for what I tried to do, and I'll have leave-behinds for committee members that could not be here today, was just kind of some background information that they could go to look at, what I'm speaking with today. And some of it is about the VA, the federal VA, and the VISN, so you can see their catchment areas from St. Cloud and Minneapolis and what they're responsible for. And now, homelessness in Minnesota for veterans. You're going to see a lot of difference. I took this number needs to be updated, but in general, there are somewhere between, is it 360,000? There is a number of veterans in Minnesota, depending on where you get your source, between 360 and 380. And of that, what I say for homelessness, we take into, you've heard about the PIT count, is the federal once a year count. You've also heard about the Wilder survey, which is a 3-year survey, statewide, again, on a single night. I can now tell you anecdotally what I see as MACV. And as Minnesota Housing stated, those numbers are low because, of course, in January, when you're trying to count homeless individuals, you're not reaching all of them. But how big is it really? What I say at MACV is that 1% of the veteran population in this state in a year is going to have a crisis that could lead to a homeless episode or be homeless. So in relative terms, what's the target we're talking about? 3,000 to 4,000. Now, that's also those that are right on the brink of homelessness. But when you think of, when my organization thinks of who are we serving, who are we targeting, it's those 3,000 to 4,000 that are having an issue. And we were able to, I know that the PIT count, the point in time count, is low because MACV served more homeless veterans last year than that count. It's just that, you're trying to frame it. I don't, so we know that they are a little bit low, but I'm trying to give you, well, what are you really looking at? And I'd say it's this housing, the homelessness, the prevention on the verge is that 3,000 to 4,000 that we're looking at in this state. And as far as homelessness, again, statistics. These are also taken when the federal VA says 67,000 on any given night. Again, those statistics follow through for Minnesota, and we are addressing it. I wanted to mention when Minnesota Housing stated that they talked about their PIT count, 350, and then there was a 31% decline of veteran homelessness between 2011 and 2012. And yes, and because some of the programs are working, but I wanted to let you know that when you dig a little deeper into that big decline, it was also the time when HUD-VASH vouchers were coming out, and that we got a lot of those HUD-VASH vouchers, and we got them in first Hennepin and Ramsey County, where a lot of these veterans are presenting with homeless issues. So we would hope that program is working and that there would be a decline. And I think the other thing Minnesota Housing pointed out, which is absolutely key, ending homelessness by 2015. I like to set the stage for how I look at that as well, and they addressed it too. People will always present in crisis. There are things that were always going to happen. The key is, by 2015, both federally and in the state, do we have the programs in place? Have we made the number of affordable units? Have we made the commitment to those units that are available to effectually, help end homelessness? So as they said, when they present as homeless, Do we have the programs in place to quickly and immediately assess them and get them to their appropriate housing option? And later this afternoon, that's what I'm going to be talking about, is it's housing options. And you need the full continuum of care of options, from emergency shelter all the way to absolutely independent and permanent with no services. Everything else are options that the individuals that we serve are going to need. So I hope that kind of sets the stage a little bit on statistics and homelessness. Again, if you want to dig into it, I have a lot of statistics on of homeless veterans, what are some of the subcategories and things like that. I think one of the ones is that 85% have completed high school. In other words, there's a lot of completed education in this population. And when you do look at the subpopulation of veterans and homelessness, you see some very interesting things that we at MACV then target and understand, so we can pick appropriate housing and appropriate services for them. A lot of this, and I can go back to it, homelessness in general, not just veterans, they're presenting with some pretty chronic needs in the beginning. From, it could be alcohol addiction, post-traumatic stress syndrome, PTSD. We do see in the homeless population that they have mental and physical health needs. And so at the very first, before you can decide what's the appropriate housing for this individual, you need to stabilize them. So you need to bring them in and stabilize them. And this afternoon I'll talk about programs that I have that are available to do that piece. Then when they're stable, what's the next best step for them? And again, it's that continuum of care of housing all across the spectrum. Homeless veterans, basically, again, I look at the services of MACV, there's two categories. If, and you all know this, if you can prevent an episode of homelessness, that is the cost-effective way to do it, once, especially with a family. Once a family gets into homelessness, it is extremely expensive to get them out of it. So our programs and services are, yes, anyone that presents as homeless, we have programs and solutions, and of course, we try to prevent that episode of homelessness. And I'm just going to overview some of my programs that I have that aren't directly the housing that I own. I do have 77 units of housing in a different spectrum that I'll talk about this afternoon. But MACV helped almost 1,400 veterans and their families last year. So I did something with the other 1,400 that wasn't direct housing for MACV. And that's what some of these programs address. We provide intensive case management and direct assistance. Now, I have a lot of different grants. I'll show you some of my funding sources. But in general, especially for prevention, we are doing short-term rent assistance, security deposits, utility assistance, transportation, food vouchers, thinking of what are the things that we need to do to stabilize this individual and their family. We work in partnership with all of the county veteran service officers in the Minnesota Department of Veterans Affairs. I state this every time I speak, but I can't say it more strongly. We do not duplicate what they do with our programs. My staff understands their programs. Their staff understand what we do. And we then leverage each other's funding sources to effectuate the best outcome for that veteran. So we refer to a Minnesota Department of Veterans Affairs program. We refer our veterans to the LSS CORE program for mental health services, for counseling. We work in conjunction with them and in partnership, so there isn't this duplication of services. My funding sources come from a variety of different grants. As you're all familiar with nonprofits, I do get a fair amount of federal funding, which, by the way, after I leave here today, I have somehow got to figure out how this shutdown is dealing with. I have HUD, Department of Labor, and VA federal funding, and I have a lot of interesting challenges presented to me today because of that front. State grants, we get, I have testified here, our main state grant through the Minnesota Department of Veterans Affairs that addresses and state, case management and services for veterans. A Department of Labor grant that's employment focused for homeless veterans. I have a variety of HUD grants, more related to my housing, supportive service and operating that I'll talk about this afternoon. SSVF. You might have heard of that. That's 3 years ago, the VA, federal VA, came out with supportive services for veterans and their family grant. And we are a recipient of that grant in Minnesota. Again, it's prevention and homeless dollars to support. It's got its own set of eligibility that is a lot more in some ways. That's what I do with the word cobble that they use. That is certainly right. I cobbled together lots of different funding sources that all have their own eligibility so that I can have something to help that veteran that's presenting themselves to us and try to make it as broad of eligibility for a MACV service that I can do. And donations, foundations, both locally, I'll get some foundations that want to give to the veterans in a specific geographic area, and we'll restrict that money to do that. Eligibility for services. You had an excellent question, Representative Detmer. I can tell you later today what we do. I'll tell you now in general, MACV follows the state definition of a veteran, which is honorably discharged, 181 days of active duty service. I do that for my housing as well. Federal definitions are generally other than dishonorable. So when you have federal funding, my federal funding would allow me to assist a broader group, but because we have focused on, the state definition in Minnesota, I think we have to align again in order not to duplicate and stuff. MACV has aligned with that state definition. There are times when I will do an other than honorable if only federal funding is involved. But that gets pretty difficult when you've got a case manager paid partially by the Minnesota Department of Veterans Affairs grant that we get through the legislature looking at a federal fund. So I know that we focus on the honorably discharged veterans. It is interesting, and I can find out, I know Minnesota Housing can. We have veterans that we have assisted with a deposit, to get into veterans and community housing and things like that. And I know my staff would know what the eligibility is, but I know they ask for some sort of eligibility of veteran status. But it's a very good question because it should be rigorous to ensure that they're at least presenting with some form of identification that they are veterans. Yes, sir.
Thank you, Mr. Chair. And just to follow up on that, that's important that we identify that these people are truly veterans. And, do you help them in terms of getting their DD 214 to verify that they are a veteran? Or
Absolutely. Absolutely. But we do that through our county veteran service officers, we make those direct referrals. My staff knows how to, depending on where they present, are they coming into Duluth or Mankato, but they know how to get a copy of that documentation, absolutely, if they don't have it. And we assess any of our programs. Now, I'm going to try to be general, and I tried to put a couple slides together. When someone presents to us, we have to assess the whole person. You can't just take care of their, as you hear all the time, you can't just take care of their housing. What are their issues? What is the reason that they're homeless? What are the issues that they can't keep their housing? It could be a variety of these things here. You know, they're of course, mental health, their health status, both mental and medical problems, employment and income, living skills. We assess the individual that comes to us, and with all the programs that MACV has, with all of the housing that is out there, we attempt to make the best appropriate referral per that individual and what that individual needs when they present themselves to us. I've talked about different programs, different things that we provide directly to the veterans through our grants. And of course, our desired outcomes for any of the veterans that present themselves to MACV. We want them to have a stable housing situation at the end of us working with them. Now, that might be permanent housing on their own with no more supportive services. It could be permanent supportive housing. It might be a HUD-VASH voucher, because that's the appropriate level of care that we think they need. It might be a referral to the veterans' homes. When we assess the individual, we are trying to look at where are they in their life and what do they do now, and then make that appropriate referral. So I'll keep coming back to, from emergency all the way through to permanent, you need all of the options all along the way, because we must be client-centric. We must focus on the veterans and what they need and make different options available to them, so we're meeting their needs. At a very high level, again, my programs, we have an employment program specifically to employ homeless veterans. And I've talked about that. We have that also in Duluth and the metro area. That does not mean that in Mankato, they don't try to help people find jobs. It means that I have case managers that I have funded federally that can focus on this full time in the metro area. We still, any veteran that comes to us in any of our regions, we look at their employment status and attempt to connect them to things that are going to get them a job. Vet law, I talked about our legal services. We do legal clinics throughout the state now in communities, all veterans welcome. And we are trying again to address those barriers to their housing and employment. If you do not, and I know if the federal VA were here, and I know I can state this, that when they do their survey of homelessness, one of the top things that remains the critical thing to address are the legal issues. If you've got child support that has never been modified based on their new income, they're going to get a job, and what's going to happen? Their entire wage is going to be garnished. And it's a bit disconcerting. So it's addressing those legal issues so that they can remain and be in stable housing and keep their employment. Those three things, what MACV focuses on, are all tied to the end stability of that veteran remaining housed for a long period of time. So our different clinics are around the state. We do service providers we work with. I was just showing you, again, we pull in pro bono attorneys and law students and child support workers and county veteran service officers. At our one-day clinics, we have all of these individuals there so that we can attempt to effectuate a change from when they walk in to when they leave. And it is possible to have child support, everything all filled out and modified at that clinic. Now, that's not sending them somewhere else then. So those clinics are really good in taking care of some of the situations that present. We also have our stand-down events. They're like Project Homeless Connects. We do those all around the state as well, bringing all of those service providers together. And we do a court component at Duluth and the metro for stand-down. Our stand-downs this year, I took over the metro stand-down back in 2007 or 8, and since then we've added all of these other events. So what you start to see here, MACV statewide outreach. We're using the clinics, we're using the stand-downs to get into communities so that we can get them together, focusing on veterans issues, so that when we leave that day, they continue, those partnerships are there, focusing on these issues. These are a couple pictures of our Metro stand-down. And I'm getting to the end of my what I hope was a brief overview of all my services. But MACV as a nonprofit, I come in and I look at the gaps. We are that safety net. What are federal programs, state programs, county programs? What are the gaps? And sometimes those gaps are eligibility. It could be income eligibility. They're literally $10 over an income eligibility for utility assistance from a program. We can fill that gap with our funds. Of course, statewide, non-duplication of services, the leverage sources of funding, you also heard from Minnesota Housing, partners, collaborators, the case management, and that's what we provide to those prevention cases, keeping them in their own housing, as well as our housing models and our actual housing that we provide. And that last safety net and bridging the gap. And these are just a lot of the different, I put this up all the time, but again, we don't duplicate other things that are out there. We work with it and are that last piece. So then I'll take any questions I'll take any of your questions, of course. But this is my housing presentation for this afternoon, where I get into what does MACV do for housing.
Thank you, Mr. Chair. I don't know if we're getting a copy of the PowerPoint at some point. I was intrigued by your the history, the beginning of your organization.
Yes, ma'am.
A nurse.
Army nurse, World War II.
Who saw gaps, right, where the
Yes.
establishment didn't quite fit for.
She worked at the Minneapolis VA.
And so the question is, do you today see federal rules that are barriers that to fully provide for everyone?
I am pausing because I get a lot of, I'm sorry, sir. Yes. Representative and Chair Newton, I get a lot of federal grants. So I would say, I will. I absolutely will. I will say that there are definitely things that those grants do not address. And one of the major things is that federally it gets into gaps are created by definitions. People use different definitions. And the Department of Labor, HUD, and the VA all use a different definition of what a homeless veteran is. Gaps present themselves. There are also things that the grants I get do not address. For example, the SSVF grant will not do mortgages. Then they start to have their list of things they won't pay for. They won't pay for, I have been persistent at the federal level of making it known what I think their gaps are. And I believe there have been some inroads in that when the SSVF grant started 3 years ago, I am not a quiet person. And they would not pay for any emergency services for a family presenting that was homeless. No emergency hotel stay. Nothing like that. And I said, how can you have a program that you're not, rurally, we have nowhere for them to go. We now, this year, October 1, except it's shut down, but I still have my grant now. But my grant starts today, and I have no support federally for that, but we can do, I better do a lot of emergency services quick before they realize. They have put that into, they are making changes, they are listening. I am seeing that they are listening to gaps, but gaps still exist, absolutely, with that.
And Mr. Chair, I would just observe, this isn't just in this area, but in a number of areas when federal government shapes a program for each problem, and then you get these streams of funding, at the local level, it doesn't necessarily mean then we're in a position to deliver the service most effectively and efficiently because of the silos.
Silos, yes, that's a very good word, Representative, and that's absolutely true. Now, I know with the federal VA, they specifically made, I keep using SSVF to kind of keep us on one program, they made that available to community partners like a nonprofit because they knew they were not set up to directly address these issues. So they are trying to realize what they can do in their silos and what they're going to provide, and then, but what can we do to try to get some funding so that in the communities they can determine what their needs are. And again, in Minnesota, that need in Duluth is very different than that need in Minneapolis. So it allows us to tailor the needs in a specific community with what those veterans that are presenting with issues are allowed to do. But siloed is a very effective word for how they view and attack an issue.
Ms. Vitalis, do you think there's a role for the state legislature in helping to fill some of those gaps between, where the federal agencies don't align? Is there a place where the state legislature could help you?
Well, of course, I would say you are. And you are by the fact that you have supported the grant to MACV, and that you realize that those are the gaps that we focus on. You supported the funding for the county veteran service officers for outreach and looking at things like that. I would say, and I also have counterparts in other states that do what I do. Not that somebody can't, do something more, but in Minnesota right now, I feel that the state legislature, in looking at those gaps in veterans by what you're already doing for your support in these areas, is really good, and it's forward thinking. Now, I'm not getting into affordable housing units and that discussion. I'm just talking about the service part of that. Are you doing a good job I think you're doing a good job of listening and a good job then of supporting programs that are taking care of those things.
Thank you. Are there any other questions? Representative Clark.
Pass. Excuse me.
Okay. I hope I didn't frighten you.
I just packed up my cough drops. Maybe I can offer it. We're coming back here.
Okay. You can hold that thought for a minute. I would like to ask MDVA if you have anything to add in the interim here, Commissioner Wold, regarding a couple things. One is the Commission to End Homelessness, MDVA's role and where we are with that, and anything else that you would like to add regarding homelessness. Thank you.
Good afternoon, Mr. Chair, members of the committee. If I need to identify myself, I can do that.
Please.
Deputy Commissioner Worrells, Programs and Services for the Minnesota Department of Veterans Affairs. We are an active participant with the Minnesota Interagency, excuse me, sorry, I should probably get one of those cough drops too. Coalition to End Homelessness. We're involved at all three levels, from the staff level to the senior level to the executive level. We agree that we can align with the federal guidelines to end homelessness, or the federal plan to end homelessness, but as everybody that's testified here to said today, it's going to be on an individual basis. There's going to be presentations where I think they're going to go on until the end of time. We talk about the resources that are needed to address it, but we also need to talk about the barriers. And one of the greatest barriers that we have to truly providing service to veterans is the veterans themselves. there's a stigma out there. There's a strength in veterans that is very difficult to overcome. They are going to be the last people to step forward and ask for help. So our greatest challenge, of course, is going to be overcoming that stigma. It's also going to be around creating more awareness out in the communities. One of the things that I note quite frequently is where the homeless issues are coming from. And we're seeing a lot more of that coming from the communities of color. There is not a lot of resources in the community of colors. We're doing a very good job reaching out into those communities. Hennepin County, Ramsey County, where we have a larger population for veterans of color. I think we're doing some great work there. I think we're making some inroads there. But as we take a look at the statistics, the veteran population will decrease, but the people that are going to increase within that population are the people of color and, of course, women veterans. To answer your question about what can the legislature do to assist us better, and I have to agree with Kathy Vitalis. This last legislative session really put us in prime position to be able to do more around this issue. Giving some additional funding to the county veterans service officers, which of course is an unfunded mandate, but giving them those additional dollars to be able to go out to heighten that awareness, to look at transportation programs, to look at ways of being creative to address all issues, not just homelessness, is key. Also, the ability for veterans who have been displaced not only from their homes but from their jobs. The Minnesota GI Bill is going to create excellent opportunities for people that have lost their jobs to go back out and make a good living and hopefully, provide for their families going forward. So I would say again, we really appreciate, the funding that you've provided to this agency, and of course we're going to welcome ongoing conversations with you as we address other issues that might need to be addressed at our level.
Thank you, Commissioner. And if you would, perhaps give us some details regarding the issue of veterans of color and homelessness. If there's anything that you can add, if you could pass it to Ms. Mullen, so that we can also look at that and see, what additional steps we need to take. And also within that category, the American Indian community, where we tend to have more as a percent American Indians who are represented in the armed services than other groups.
Yes, sir.
Thank you. Thank you, Commissioner. Kathleen, I think we're still waiting
Okay.
for everyone to recover. Oh, okay. Yeah, let's do that. So that you don't have to wait. Perhaps this afternoon, I expect both Representative Clark and Hausman will be here, and we can address whatever the question is at that time.
Okay.
Is there anyone in the audience that has any wishes to testify or to say anything on the issue of veterans' homelessness? Okay. Yes, ma'am, if you'd like to come forward. Please come up to the table and identify yourself. Yeah. If you would, ma'am, just give us your name for the record.
My name is Chris Ronning. My question is the percentage of female homeless veterans. And I know that is a very big issue. And I know that for a fact, a lot of the female veterans do not want to come forward to let you know. They are ashamed, they are embarrassed. Some have children in fear of having the children taken away from them if they don't have a proper housing. So that's something I think that's very important, that we also address that we have female veterans out there.
Yes, thank you. I don't know, Ms. Mullen, if you have anything on percentage of female veterans in homelessness?
Chair and representatives, I don't see a specific breakdown based on gender, just that the overall Minnesota population for 2012, based on the Wilder study, was right around 10%.
Around 10%. And I think, as you know, ma'am, that we've got an increasing number of women who are in the armed forces, and this will be an issue just based on logical percentages that we're going to have to monitor and to make sure that we've got accommodations for our female veterans as well.
Okay, thank you.
So thank you for bringing that forward. Yes, Representative Clark.
Mr. Chairman, I was thinking one of the, for this witness,
Ma'am, if you'd like.
I just wanted to, I want to say thank you for coming forward, and I'm just wondering, when you're talking about the women, it seems like one of the other issues would be the children that are often with those women, and I'm just wondering if you have anything to say about that as a particular issue. Some of our...
They come home pregnant, and they have babies, they have children, and there is some women, they come back and get pregnant, and I know that's issues with that. So when they have little children, they're afraid to come forward and let them know, for fear the children will be taken away from them. And that's been a big issue, I believe.
Thank you.
I think, Representative Clark, the one statistic I showed is that the majority of the women who are homeless it's as a result of abuse by their partners in some way, and they're trying to escape from that abuse. So, yes, sir, please identify yourself. And
Mr. Chair, members of the committee, I'm Milt Schoen. I'm the Hennepin County Veteran Service Officer, and I'm the legislative chair for the County Veteran Service Officers. I think Representative Detmer raised a couple questions about veterans being served. HUD-VASH vouchers, for anybody to get a HUD-VASH voucher, they have to be served by the VA Medical Center. So they've got to meet the definition of being a veteran. So all of those veterans that are receiving HUD-VASH vouchers are veterans, and they've got to go through a process through the VA to obtain that. The Minneapolis Veterans and Community Housing that's got the 140 units, that's sober housing. And that's a very important piece, because when you deal with the problem, you've got to take a look at where you can achieve some outcomes, and certainly that's one area where 70% of those individuals in those housing units are veterans. So we've got about 100 veterans that we know are living and maintaining their sobriety, and that's a plus. And I think in the coming session, there's a desire, I know, from the Minneapolis VA Medical Center to increase the number of units of sober housing on campus, because there's a need for them. There was mention of Common Bond and the project that's going to be built on the upper post of Fort Snelling, 6 units for families and 52 units for single. That's housing for dual-diagnosed veterans. Those veterans don't have to maintain sobriety, but because of the case management, they're going to work on their behaviors. And that's a very important piece, that people do get case management, and that we just don't give somebody a housing voucher, but we try and figure out, not just give them housing, but figure out how you deal with some of the underlying problems. And so that's a piece. What the VA is doing nationally, there's been made mention of eliminating homelessness. In 2008, I think there were 8,000 HUD-VASH vouchers in use nationwide. Today, there are 48,000. So there's been a great increase over the last number of years in the use of HUD-VASH vouchers. There's another 7,000 that are in the pipeline, and I know the President is going to be, and his budget is going to be requesting more of them. Those are vouchers that are targeted at the individuals that have the most serious problems. And if you're going to try and solve the problem, you probably should allocate resources to people who have significant issues and to try to deal with those issues. And I think that's what's being done on a national level, and I think in Minnesota we can work with that. I think we've got some resources. We've got the Minnesota Veterans Homes. We've got board and care that can serve some veterans, and there are some resources that can come in that can come into play, and I know as we address these issues. But I think it's important that we target and not just throw resources out there, but make sure that we're trying to deal with the underlying problems. What we see in our county, 95% of the people that come before our Veterans Court are there because they were using drugs or alcohol at the time of the offense. And so you really need to deal with some of the underlying problems if you're going to try and get to a solution.
Thank you, Mr. Schoen. Representative Clark.
Thank you. Mr. Schoen, this is...
Mr. Schoen,
Can I just...
wait.
Thank you, Mr. Chairman. I was listening as you were talking about the facility that's being established out at Fort Snelling, and one of the things that I noted, which was the question I was going to ask earlier, Chair Coffin couldn't ask, is do we have places where people who have not been able to become sober or can stay sober can stay? And it sounds like that there's a facility there that you're working on. One of the reasons I was going to ask it earlier with the MACV folks is I noticed that they're for example, townhomes are alcohol, drug, and violence-free, all important things. But a lot of the veterans who are struggling with their alcoholism or drug addiction or whatever, I'm concerned that we also think about intermediate steps, treatment, of course, which we don't fund very well in this state or anybody. But I'm wondering, and I actually in my district we actually have a facility. It's a wet dry house. It's one of the few, and there's one in Duluth too, where people don't have to be sober, but they have a place to get off the street and not be homeless, so that they can work towards their sobriety and other issues. And it sounds like what's happening out at Fort Snelling, one of those facilities might have that a mission. Is that right? I want to make sure I understood.
The Common Bond Facility is going to serve individuals who are dual diagnosed. They don't have to maintain their sobriety. They will have intensive case management from the VA, and as a result, hopefully they're going to reduce some of their use of chemicals. They'll take psychotropic medications. They'll do things to ensure that they have a more stable life. There are other people, the people that are being served by the HUD-VASH vouchers. There's $7 that HUD pays for every $1 of VA case management. But with government, it's an interesting thing with the federal government getting two departments working together to say we're going to try and solve the problems of this population, and one of the pieces is housing and the other is case management, and we'll tie them together. I hope I answered your question.
I think so, and I guess just a question just to leave with us to continue on is, do we have the kind of resources, or enough of the kind of resources dedicated to really helping those folks who probably in some cases are evicted from the housing that we've let them take advantage of because they've fallen off the wagon and they're not sober anymore. And I'm just thinking about situations I know of with that. So are there ways? It sounds like besides that one facility, are there others that are in the system that are being proposed, or? Well,
Mr. Chair, Representative Clark, we've got Anishinaabe, Waukegan.
That's what I was referring to.
In Hennepin County that I know in working with the people at St. Cloud VA Medical Center, they've had a desire to have wet, dry housing there because it certainly helps in terms of getting working with the population. If you've got people who are not going to move to sobriety, to maybe kind of separate them out, get them in a safer environment so that we're not spending a tremendous amount of money on those individuals and having them fail just the same. I think you need to look at the problem holistically, and there's certain people that the wet dry housing works for. I think the VA's model is to have case management and to reduce harm. There traditionally has been the one of moving people to sobriety, because once you do that, you solve the behaviors that lead people to being out on the streets.
Good. Thank you, Mr. Schoen. Mrs. Vitalis.
Yes, I came back, Chair and Representative, to answer your question about the MACV housing is drug, alcohol, and violence-free, the housing units that I have. And again, though, I get back to the continuum of care of housing and all the different models and options. If someone presents themselves to us and that's not the appropriate model for them, then we will look at the other housing options that are out there. And if it is a wet, dry housing, if it is, and I believe what everyone is also talking about here is the harm reduction housing first, model versus the sober model. But even in our sober models at MACV, if they use, we don't kick them out. We work with them as long as they're working with it. So you tend to start getting overlap, and you know that there are definitions that really do start to overlap, and it comes back to what does that person need? What does the veteran need? How are they going to be best served right now, and where should they be placed? And I agree, the more models we can have out there in the communities, that's just the answer, from a wet dry to totally sober, because there are some that need both in order to become successful. Does that answer your question?
Good.
I think
Good,
so.
Clark.
I think so. Thank you, Mr. Chairman. Yeah, my question was partly answered, and you kind of volunteered another answer, which is when people in your housing, lose their sobriety, you don't automatically evict them. You work with them on that situation. And
That is correct.
is that? I guess it would be interesting to see what kind of, information you could provide us with that. What's worked for you? What services are available? What services you just can't get those folks to? I would just be interested in the follow-up to that.
Sure, absolutely. And we talk about positively motivated. If that veteran, they're going, life is tough and stuff's going to happen, and they're going to make some not so good choices along the way to stabilizing their lives. And we work with them as long as they have a plan and they want to work with it. And I would say that probably about 35 to 40% of the individuals that go into the MACV units of housing that I own and operate relapse. There's issues. We work with them on that. When we don't, we call it a participant-induced discharge. You've got to, and we'll try to find them the appropriate place, but we can't allow the behavior to continue time after time because of the other individuals there in that model that are trying to remain sober. I wanted to quickly address women veterans, which was wonderful that got brought up, to put a percentage there. About 15% now of the active duty military. They're also about the same percentage of who MACV sees. And I did not address our women veterans. And we actually opened up a transitional home for women veterans that I'll talk about this afternoon.
Thank you very much. Commissioner DeLucia.
Mr. Chair, thank you very much. Members of the committee, good afternoon. Tomorrow I'm going to probably spend a lot more time talking to you, but I wanted to step up because I think what you've heard often today has been the combination of definitions, common languages. I know you and I have spoken about this, Mr. Chair. I think it's imperative that we understand some of these definitions as they cross between programs and services at MDVA, the federal VA, MDVA is an agency, the homes as a division of that agency. So you hear often Minneapolis VA. When you hear Minneapolis VA, I ask the members to remember that this is really talking about the federal VA. Some of them are pretty good. The testifiers will say federal VA, but it's very important because often we get confused both in the public and certainly I would think as the legislature is looking at hearing Minneapolis all of a sudden becomes the VA. The second thing is case management. Case management from a homeless perspective is not the same as case management from a health care perspective. As we discussed before the hearing, the Minnesota Department of Veterans Affairs Health Care, the veterans' homes, do not and are not a requirement to be homeless to come to me. Do I have folks that have experienced homelessness? Absolutely. And as you heard from MACV, they refer people to us as they go through their transition of life, as Kathleen and even as Housing discussed with you earlier. They're a socioeconomic model. We are a medical model. We provide care. my veterans that live either in my boarding care / domiciliaries, they're not independent livers. They would not be able to survive by themselves. They need the medical care, they need the prescription drugs, they need that oversight, and they need structured programs to address those medical issues. Common Bonds, MACV, the Housing Commission that finds housing out there, those folks, even under HUD-VASH, the connection to HUD-VASH is to get them to the VA, to get them to be addressing issues that they have, but they are independent livers. If they cannot do independent living, they will eventually come to a more structured situation such as the domiciliary. So I want to make that very clear because I think it's very easy for us as we go through these two huge, complicated programs, health care for veterans and homelessness of veterans, to blur the lines. And I think that there is perhaps a transitioning of them, if you will, that is, I go from the street to a structure, to a plan, to perhaps back to independent living, or if not, into a domiciliary like Hastings or Minneapolis, where they have that structure and where our goal is to see if we can optimize their care to a point where they may, and I use that word and emphasize that word, they may be able to realize independent living again. And so I think that I wanted to clarify that because as we get through the next, certainly this afternoon and then into tomorrow, the purpose of the homes is to take care of those folks that either need skilled nursing or need a structured environment in a domiciliary and are not independent livers. And I think that that's an important distinction. So I appreciate your tolerance. I know I'm the thing stepping between you and lunch, but I thought that that would be important for us to make sure we clarify.
Thank you, Commissioner. Are there any additional questions? Anyone else want to testify? Okay, if not, we stand in recess until 1:30, and we'll come back and come back in session at 1:30. Thank you.